There are a lot of false videos on the internet about the best medical drug for pain in the ear it is wrong. Pain in the ear may be with cause from the ear or from outside the ear, and according to the cause, the treatment or the medical treatment will be. So there is no one single drug for pain in the ear at all for all cases and all patients. It is false. Neuralgia or pain in the ear may be primary from the ear or secondary or preferred from outside the ear. A different diseases and causes can cause pain in the ear, as we will see, from auricle or pinna, trauma, hematoma, pericarditis, from external ear wax, foreign body, otitis externa, exostosis, maybe from middle ear, maybe from mastoid. So there is different causes of pain in the ear, and according to the cause, the treatment will be not one cause and one treatment, as some people believe. So impacted wax may be the cause of the pain. Middle ear, acute otitis media, secretory otitis media, otitic parotrauma, mastoiditis, acoustic trauma, and else. We will talk about the most common cause and how to manage it. The first is the wax. Normally there is a wax in the ear, but abnormal amount of the wax or impacted wax will lead to pain, some sort of pain and discomfort in the ear. So if the wax become more or it is impacted in the ear, there may be pain, as we will see in the picture now. There is normal secretion of wax, but excessive secretion or narrow canal may lead to impacted wax and pain. Treatment is removal or glycerin ear drops, but not if there is perforation. It is mistake to take ear drops. Ear furuncle, furunculosis, at the hair follicle, pain and swelling, discomfort. Treatment, glycerin pack, systemic antibiotic analgesic. The hair follicle be inflamed and may be there is pain. Also acute otitis externa. How to diagnose it? By tragus sign. Clinical examination. When pressure on tragus, there is pain. There is hotness, severe pain, causative organism Pseudomonas, staph, clinical features pain, scant discharge, debris, treatment oral toilet, medical wicks, systemic and topical antibiotics with steroids or analgesic also. Now, otomycosis. Otomycosis, fungal infection in the ear. Aspergillus is the most common. A predisposing factor, water in the ear, hot, humid climate, using local ear drops. Clinical features, itching. The most common is itching. Treatment by oral ear drops for antifungal. There is a picture of otomycosis. Some called it newspaper. whitish patches with some dots, black dots. Acute otitis media, acute infection in the middle ear, causing severe pain, deafness, ear discharge by otoscopic congested tympanic membrane. It is very common in infant and children by strep pneumonia. The most common bacterial cause is strep pneumonia. Otitic barotrauma during plane traveling, changing in air pressure, make ostichian tube dysfunction and pressure on the tympanic membrane. So when you travel, it is you can chewing gums to open always ostichian tube to avoid otitic barotrauma. Recommended for you also nasal decongestant before airplanes or diving. If you have any problem in sinuses or in nose. Clinical features: severe Earache, hearing loss, tinnitus. Treatment: nasal decongestant, antihistaminic, maybe systemic corticosteroid. Prevention: swallowing during the descent, not to sleep at the airplane travel, Valsalva maneuver, closing the nose and mouth, and make Valsalva. Refer the pain: it is pain at the ear but the cause is outside the ear. Normal ear and there is pain in the ear. The cause is outside the ear. What is the causes of referred pain? We will summarize it. Dental causes: the first one, temporomandibular joint dysfunction, tonsillitis, pharyngitis, cervical spine arthritis. The most common cause is the dental: abscess, impacted teeth, caries, and all. So there is different causes of ear pain. According to the cause, you can manage it well. But you take one drug for any pain in the ear. Okay. Now, if there is acute severe pain in the ear for adult or children, what shall you do as first aid? First, the local ear drops, analgesic drops. It is not preferred if there is acute otitis media, perforated tympanic membrane, bolus laryngitis. If there is no of these causes, you can use it. So if you don't know what is the cause, it is better to avoid local ear drops. You can instead use systemic analgesic as injection, Adolor, ketolamine. It is very potent analgesic, intramuscular or intravenous. It is very effective in acute severe pain in the ear. You can take it and the pain you will get rid of the pain in several minutes. The second is the sachet catafast, put in water. It is diclofenac, NAC, potassium. Also very effective and rapid. But note, if you have gastric problem, better to be avoided. You have peptic ulcer, gastric ulcer, it is better to be avoided. Instead, you can take um, injection, as the injection go directly to the circulation. Third, to children and infant is the suppository Voltaren, diclofenac sodium. It is very effective also in case of severe pain in the ear. It is